Before we get started, we'd like to start by saying we hope you had a great holiday season and are having a great start to your new year. For those of you who don't know or haven't heard it before, that noise you're hearing in my background is my cat. So she's got a lot to say about this webinar. We're excited to get this year started. We'd like to welcome you back to this webinar series. We know at the end of last year, we said our plan was to resume the series on January 8th, but with Governor Newsom's 21-22 budget announcement, we had to push the year's first webinar to today. Also, as we looked back and evaluated our need for weekly webinars, we determined these webinars can occur every other week. It will allow us at CDE to still connect with all of you and bring you the most up-to-date information while we continue to work on transition work and engage more with you as we look forward to plans for state preschool. You can look for a coming announcement on this, but the next webinar is scheduled for Friday, February 5th at 10 a.m. Before I turn it over to Erica, we want you to know that we at CDE support, we understand you are doing your best to support children and families. We understand that you're experiencing unprecedented challenges with distance learning and are concerned about staff and health issues, as well as your own health. We want to take a moment to thank each and every one of you for all you do. In addition to the ongoing work that you each do every day, we know the pandemic has created an almost impossible work situation. It's definitely been one of the most trying periods of time for all of our early learning and school communities, both personally and professionally. Our children, our families, our programs, our early educators, our schools, our teachers, our administrators, already dealing with the stress of learning and continuing the school year during the pandemic, are now dealing with or are continuing to deal with economic hardships and job losses. None of us could have ever anticipated anything like this, but we all continue to be inspired by how you all have risen to the challenge. As we move forward, we're hopeful to move into a safer phase as the vaccine rolls out to more people, and are appreciative that this field has been recognized with its TK-12 peers in terms of priority for the vaccine. Changing topics, I think when we turn the page on 2020, we all reveled in a promise of what 2021 would bring. And while that's still appropriate, as there's still so much to be hopeful for this year, we were confronted again with a reminder that we have a long ways to go to address how people are treated based on the color of their skin. We also have a lot of work in front of us to address hate. So, and I'm thinking back to 2 weeks ago, on January 6th, when we've witnessed a violent attack on our democracy. We also witnessed a double standard in how the crowd that attacked our Capitol was treated compared to how crowds protesting the killing of Black people have been treated in too many situations over the last year. Our nation, all of us, are reeling from the storming of the Capitol, and many of us are trying to understand those events, how they could have happened. It's unfathomable for us as adults, and I'm sure it's even more difficult for the children in our programs, for our own children to comprehend. We need to remind ourselves, and I'll borrow from the superintendent here, the power of education is a tool we have to end hate and bigotry and to empower communities that have been made vulnerable by systemic inequities. Strong early learning and care programs are another powerful tool which has been proven as a way to combat some of these systemic inequities and support all our children to learn, thrive, and grow. And building on that and coming back to the promise that we have of this year, and as we look forward with an optimistic view, we are excited that tomorrow represents the first time this nation will swear in a vice president that is female, Black, and South Asian. To adapt somewhat from Vice President Harris on quoting her mother, while she may be the first, she won't be the last. While I recognize that's not the exact quote, I say she won't be the last because we need more people as decision makers that reflect the diversity of our country. We need more women in government, and more Black and brown women making decisions. Continuing with this optimism, I also want to take a moment and acknowledge that tomorrow is the start of the Biden-Harris administration, and we're excited for the potential this administration has for expanding early education in this country. We have a lot of room to grow, and we also have a lot to be hopeful for this year. And with that, I will turn it over to Erica Otiono, the Early Learning and Care Division's Associate Director.
Thank you, Steve. So this is Erica Otiono, Associate Director. I hope you had a good 3-day weekend and you found the time to relax a bit. And since this is our first session in 2021, I want to say Happy New Year. As most of you know, the Program Quality Implementation Office, we call ourselves PQI Office. We are responsible for monitoring, training, technical assistance, and support to contractors. Two presenters from that office will provide information to you today. Deborah Racine will be the first consultant. She'll provide an overview of the recently released Management Bulletin 2102. We've been waiting for this for a while. That Management Bulletin is about program quality contractual requirements. Following that presentation, Mignon Poulard, another consultant in PQI, will provide information about the Law Planning Council and Resource and Referral Management Bulletin 2101. For 2021, what a year. As we grapple with the pandemic, let's continue to share knowledge about working with children and families. And let's remember to take care of ourselves and our staff. Challenges can sometimes bring new chances for success. Let's also approach the future with open minds. Enjoy this session, and remember that we appreciate you and all that you do for children and families in your community. Please continue to reach out to PQI staff. We are willing, we're available, and we're committed to working together with you. I'm now going to hand it over to Virginia. Over to you, Virginia.
Hi. Thanks, Erica. Hi, everyone. It's great to be with you here this afternoon. For those of you who don't know me, I'm Virginia Early, the administrator of the policy office here at the Early Learning and Care Division. We are an office that works very much on all the guidance that you see coming out from CDE, and also working with the legislature, the governor's office, Department of Finance, Department of Social Services, other state partners on influencing what goes into law. And so with the legislature now in session, in addition to all of our guidance work, we have all of our technical assistance work on that policy making piece ramping up. So grateful to have this opportunity to chat with you all so that we're making sure to elevate voices from the field into those policy making and informing decisions and conversations. So thank you for all of your engagement in your programs, and thank you for your engagement in this policy process. We definitely can't do this work without you. I'll be talking later about some pieces related to the governor's proposed budget, but just thank you, and I'll turn it over to Alana.
Good afternoon, everybody. I'm Alana Andrade, and I'm a child development consultant in the policy office here at ELCD. As I am moderating the webinar today, we have, as always, a great team answering questions and making our presentation run smoothly. From the policy office, we've got Danielle Davies and Barbara Lindsay. From the Program Quality Implementation Office, PQI, we have Cassandra Lewis, Brittany Sheffield, Hier Zong, Richard Miller, Katina Boulay, Deborah Rawson, Mignon Poulard, Christina Tony, and Serene Yee. From the Child Development, Nutrition, and Fiscal Services Division, the CDNFS, we've got Corey Kahn and Alan Lynch. And from the Child Development Management Implementation System, CDMIS, we have Robert Halm and Carly Nodahara. And here to answer any questions regarding nutrition or food programs, we have Shashi Sharma. Our team is committed to being as responsive as possible. A few kind reminders. Please check the frequently asked FAQ webpage to see if your question has already been answered. In fact, we've updated our ELCD FAQ webpage just this month. As one of the questions was about additional pay, such as hazardous pay, hardship pay, and teacher stipends, and could they be considered an allowable expense? And the answer is yes, if it meets certain criteria. So I'd like us to post the link of that FAQ page. And if Brittany, if you could please put that in on our Q&A in the chat for those in our session today. And you can find that answer under the eligibility subheader. And also, while you are sending our team your question in the Q&A feature, as some of you already have been, please give us as much detail as possible. Let us know about contract, let us know about funding so that we can give you an accurate answer. And back over to Stephen to review our agenda for today.
Thank you very much, Alana. I'll try to move myself along a little more quickly this time. So as you've heard from Alana, we've got a great team on this webinar for representing different parts of the department to address your questions and to help us prepare for today and for each of our webinars. As I just reflect for a moment on this team, I love the energy and work they put into this effort. I love this team. Across the entire department, this team is dedicated to supporting programs day in and day out. As you heard from Erica, you'll hear a little bit about our guidance updates on the couple of management bulletins that have come out, as well as some fiscal updates from our fiscal team. We'll also be providing updates from our policy office, some items on the budget. And after, we'll review some questions that have come into the ELCD emergency email box. We're going to do our best to address as many of those questions as we can. You may also use, as Alana mentioned, the Q&A function in Zoom to put your questions in. Many of you have already done that, so thank you for your questions, and thank you, team, answering those questions. We're going to try to do as much as we can to answer all those questions, but anything we don't get to, we'll take back to address, and you can see them in a future FAQ update on our website. And now, over to Virginia.
Thanks, Steve. So, the budget, everyone's favorite topic. So, the 2021 governor's budget, just to explain to folks that may not be as familiar with this process, it's the governor's proposal for what the budget looks like for this year. So this is not law, this is a proposal. Over the next weeks and months, the legislature will review this proposal, make changes to this proposal, and there'll be a final one that becomes law, will be signed by the governor, and then that will be what affects programs. So I know sometimes people see changes and they think, oh, well, when is that coming right now? Or is that law changing right now? This is still very much a proposal, and there'll be hearings with the legislature where the governor will be in conversations with them to determine what the final result is. So, but we also want you to know what is currently being proposed, because it's important from our perspective to have all of you be aware of the current conversation at the policy level, so that you can choose how you want to inform that conversation. So from the perspective of fiscal changes, this governor's proposed budget has $4.4 billion for childcare and preschool programs administered by both our department, the Department of Education, and the Department of Social Services. And that's compared to $4.6 billion from the 2021 Budget Act. That is a 5% decrease. However, this is largely due to the governor removing $350 million from last year in one-time federal funds. So, and when you actually look at the numbers, despite this decrease, when you look across all programs, the state has actually seen increased investment of about $189 million in ongoing state resources. So we wanted to flag that for you. So of the $4.4 billion, it's proposed between both CDE and DSS, so between both departments. So there's $1.3 billion for CDE programs. This is mostly the California State Preschool Program, and $3 billion for the programs at DSS. So this includes the programs that they're running this year, CalWORK Stage 1, the Foster Emergency Child Care Bridge for foster families, and it also includes $2.6 billion in programs that are currently administered by CDE and will be transferring to DSS starting July 1. So next slide. So in addition to that sort of high level piece, we wanted to walk you through a couple of specific items related to the proposal. And remember, this is a proposal. So the proposal is adding $21 million new Proposition 64 funds in the current year, so sometime in the next 6 months, and $44 million next year in 2021-22, and this will be Proposition 64 funds, which is the tobacco tax funds. Oh, sorry, the marijuana tax funds for additional alternative payment program slots. So we've gotten a lot of questions about the 21 million in the current year and when that might be coming and how that might be coming and when the decision is made of whether this is moving forward. So just a note on that, we're currently learning more ourselves, so we will follow back and keep you updated as we get more information on those funds for the current year. So there's also a cost of living adjustments, which is about 39 million to fund a 1.5% cost of living adjustment for all of our programs, including those funded by Proposition 98 and non-Proposition 98. That's just a funding stream. So that includes, state preschool, general child care, or CCTR, alternative payment, migrant centers, and so forth. And then there are also some one-time emergency supports that these both will be going to the Department of Social Services. So there's 55 million in non-Proposition 98 general fund, which is to support childcare providers and family needs as a result of the COVID-19 pandemic. I think as a state, we're still waiting for some more details on what exactly that means. But that would be sort of starting in July if this moves forward. And then finally, they're also proposing almost 10 million in general fund to extend the amount of time families in the CalWORKs program who are on cash aid, for example, in CalWORK Stage 2, can remain on cash aid. So this has an impact on our CalWORK Stage 2 program due to the COVID-19 pandemic. So next slide. So one of the key areas that there's a big focus on in this governor's proposal is moving forward on the next steps to implement the Early Learning and Care Master Plan. So one of the items you may remember from a previous webinar we had about where we talked about the master plan was a focus on expanding access to preschool opportunities for children. And so the governor's budget proposal has a total of $500 million to invest in transitional kindergarten expansion to support the vision outlined in our master plan. So of that 500 million, half of it, or 250 million, is in one-time funds, Proposition 98 funds for incentive grants. And those would be for local education agencies that offer early access to TK. So they're serving children that they're not required to serve in TK that have birthdays between December 2nd and the end of the school year. And so you may remember that those districts can serve those kids but they don't necessarily get paid for everything. And so these grants would incentivize programs to expand, incentivize LEAs to expand those types of programs. And then there's $200 million in one-time non-Proposition 98 general fund for school districts to construct and retrofit existing facilities, knowing that if you're going to expand transitional kindergarten, you need to have expanding facilities. Also knowing how many of our early learning and care contracted programs are operating on LEA campuses, and so not wanting that to put a pressure as well. So these one-time funds would be to support TK and full-day kindergarten programs and promote greater access. And then the final piece is $50 million in one-time non-Proposition 98 funding to support the preparation of transitional kindergarten teachers and provide both them and kindergarten teachers with professional development to lead high-quality programs. So pieces around inclusion, social emotional learning, trauma-informed practices, restorative practices, mitigating implicit biases, and more. So lastly, on the next slide, we wanted to also highlight for you something that affects early learning from the special education side of the budget, where the governor's budget is proposing investments that would support early intervention and also inclusive early learning environments. So specifically, as it relates to special education, there'd be $300 million ongoing Proposition 98 general funds for the Special Education Early Intervention Grant. And this would increase services for infants, toddlers, and preschoolers. So we're still trying to learn more about this one and many of the other proposals. So if there are any thoughts that you'd like us to consider or any perspectives about any of these things, please feel free to put it in the Q&A so that we can capture your thoughts and make sure we're elevating them as part of the decisions and discussions we're involved in. And now I'm going to turn it over to Becky, who's going to discuss our Child Care and Development Fund state plan.
Thank you, Virginia. Hello, everyone. I am Becky Halligan, and I am a consultant at the CDE with the lead responsibilities of the Child Care and Development Fund activities. The 2022-24 Child Care and Development Fund, the CCDF state plan, is a report that serves as California's application and agreement between the lead agency and the federal government as to how CCDF programs will be administered in conformance with legislative requirements and federal regulations. The report is prepared every 3 years for the 3-year federal fiscal year period and is due by July 1st prior to the reporting period. The plan is being developed collaboratively by a team with representatives from the Department of Education and the Department of Social Services. As of July 1, 2021, the lead agency responsibilities for the CCDF will transfer to the CDSS from CDE. The CCDF's 2024 state plan will be effective for the period of October 1st, 2021 through September 30th of 2024. CDE and CDSS have solicited already input earlier this month during the Early Learning and Care Stakeholders Input Session and the Tribal Partners Input Sessions. A third input session will be held as part of the regular meeting of the Early Childhood Policy Council on February 3rd, 2021. In addition to these 3 input sessions, the public will have other opportunities to provide comments to the development of the state plan. The CDE will initiate a public comment period beginning February 15th of 2021 for 30 days, during which time the public can provide written comments to the dedicated email box at statepln@cde.ca.gov. The email box will be open from February 15th, 2021 through March 16, 2021. Additionally, the week of March 1st, 2021, CDE will host a public hearing as another means for individuals to provide input. These and other important dates and information, including the plan preprint, will be shared on the CCDF State Plan webpage on the CDE website at https://www.cde.ca.gov/SP/CDSP within the next few weeks. Be sure to check the webpage occasionally to find updates as we move through the development of the final plan. The final version of the 2022-24 state plan must be sent to the Administration for Children and Families Office of Child Care no later than June 30th of 2021. Thank you. And now over to Alan from CDNFS for some fiscal updates.
Good afternoon. Thank you, Becky. My name is Alan Lynch from the Child Development and Nutrition Fiscal Services Unit, or CDNFS, and I'm going to provide a couple of fiscal updates and reminders today. So first on the list is the rate increase applications. The due date for rate increase applications has been extended to January 28th, 2021. Contractors with a current daily reimbursement rate less than $49.54 for CCTR or $49.85 for CSPP are eligible to submit a rate increase application. All contractors currently below the standard reimbursement rate, or SRR, are encouraged to apply. To be considered for a rate increase application, the contractor must provide documentation of each cost increase. An allowable justification for this purpose may include planned increases to wages and benefits, or any other cost associated with ongoing care. The contractor could justify this by providing documentation for the increased costs they are incurring or plan to incur. This may include a list of staff classifications and increases in salaries, or documentation that supports other increased costs to support program quality. Again, we encourage all contractors with a rate less than the SRR to apply. The next fiscal update relates to the finalizing of the allocation of $110 million. So on January 11th, the survey to collect data related to the costs associated with providing care to school-aged children closed. CDNFS has begun to analyze that data to determine allocations related to this increased cost. The second sub-bullet here is in regards to emergency childcare extensions and wage family fees. So December reports are due by January 20th, which is tomorrow. These reports will be the basis for emergency childcare extension allocations and wage family fee allocations. It is therefore imperative that contractors thoroughly review the data submitted to CDNFS. You must also ensure that you have your reports submitted and certified on time. If your agency needs to revise previous periods, those revisions must also be submitted and certified by tomorrow. We understand that the CPARES is a new system for our contractors, so I want to quickly reiterate the process for submitting revisions to data, which we have discussed in previous webinars. For revisions submitted in CPARES for direct service contracts, a revision to a previously submitted report will update data for the following report months. For example, let's say you have already submitted your September and December quarterly reports, and they have both been certified in CPARES. Let's say you go back through another review today for your family fee data and find that an error was made in the data you submitted on your September report. You must revise the September data, submit, and certify. The December prior period data will automatically update within the December report. You must then review and recertify the December report as well. Please reach out to your fiscal analyst if you have any questions or issues. I will also note that we do still intend to issue contract amendments to issue the remainder of the 110 million by mid-February. And that wraps up today's fiscal updates. I know there was a lot there. Please review the listservs that have gone out or reach out to your fiscal analyst if you have any questions. And up next, I believe, is some program quality updates.
Thank you, Alan. Hello, everyone. My name is Deborah Rawson, and I'm a Child Development Consultant in the Program Quality Implementation Office. Today's PQI updates begin with our Program Quality Management Bulletin, Management Bulletin 2102. This Management Bulletin was released today, and the purpose of this MB was to provide guidance and reminders to contractors related to meeting contractual requirements in regards to program quality. Additionally, the MB provides contractors with that additional guidance regarding the implementation of those requirements during the COVID-19 state of emergency. Next slide, please. The directive of this MB was that all state subsidized early learning and care programs are required to continue to provide quality program components to all currently enrolled children and families in compliance with California Code of Regulations 5 CCR sections 18273 through 18281 and Education Code EC section 8203. Next slide, please. The following program quality elements are addressed in this MB. Parent involvement in education, education programs, staff development, developmental profile requirements, parent survey, health and social services, the environmental rating scale, nutrition, program self-evaluation, staffing ratios, and contract monitoring reviews. This MB provides many resources to support program quality, whether you're providing in-person or distance learning services. We also wanted to share with you today that the Early Learning and Care Division will be announcing a webinar for Management Bulletin 2102, which will provide more in-depth guidance regarding the specific program quality requirements for children, families, and staff. To continue with program quality updates for the resource and referral agencies, I'd like to pass it on to Mignon Pollard.
Good afternoon. I am Mignon Pollard, and I am a new education programs consultant in the Early Learning Division. The first two slides I'd like to share with you are MB 2007, the MB 2101 updates this management bulletin. And so just to refresh your memories, resource and referral services during COVID-19, the resource and referral services must continue to provide resource and referrals to all parents looking for childcare as described in Education Code sections 8212 through 8216, and continue to the extent possible to assist families whose children are receiving emergency childcare with resource and referrals to access and navigate ongoing subsidized or non-subsidized childcare services meeting with the family need. This is also reiterated in Management Bulletin 2101. Next slide. Just a reminder that the resource and referral provider vacancy updating, considering the current and evolving public health emergency, resource and referrals are strongly encouraged to collect data on childcare supply no less than once a month to maintain availability of childcare in real time. This is a continuation of Management Bulletin 2007 and provide guidance to childcare providers so that they self-report on any closure, both temporary, ongoing, and not captured by the monthly update. Next slide, please. The updates to Management Bulletin 2007 that are in 2101 are mostly expanded data collection requirements, and they are listed here, and I will go over them. The first expanded data collection update is an update on the mychildcare.ca.gov to update that data as soon as possible or when the data becomes available. To update the MyChildCare Plan databases as often as possible. And two things to really pay attention to is there are changes to the status. The status is now recorded as, you can have 4 different categories. It can be 1, active and booked to capacity, 2, active with vacancy, 3, inactive but willing to open with technical assistance, or 4, inactive closed. This is a change. The second change to pay attention to are the age categories. You'll be asked to present the age categories in both your capacity to serve and the vacancies. And the age categories are 0 to 23 months, 2 to 5 years, and 6 years old and up. Other important updates are to provide child care referrals within 24-hour request. Just reminding you to connect providers to California's preventative health and safety practices course on the early childhood education online, and to provide a trust land application assurance and coordination in the new system, in the new, to utilize that new Guardian system for live scan services. Next slide, please. And finally, just on our local planning councils, and during COVID-19, most of these requirements remain the same as they were in the previous bulletin. That is just a reminder and updated in Management Bulletin 2101, just to remain operational and accessible as possible, to identify your local, to identify and access local childcare needs, to collaborate and to meet local childcare needs, and to report newly emerging childcare needs of all families in the community to CDE and CDSS, and to continue to direct community to available resources that encourage best practices and strategies to support families. And these are the main updates. You'll see the management bulletin posted on our website for your more careful perusal, but please pay attention to those most important updates. Thank you.
Excellent. So this is Alana, and we are now going to have our question and answer space. But before we begin, we just wanted to say that at the beginning of the webinar, we like to speak on who our presenters are, who our panelists are, and who will be answering on the Q&A. And we had accidentally left off our wonderful Becky Halligan from the Learning Innovations and Improvement Offices, who gave that update on our state plan, which is currently going through some great work right now. So again, that was Becky Halligan from the Learning Innovation and Improvement Office, who's also still been answering some questions in the Q&A box.
Thank you, Alana.
And first, there have been some questions regarding, I would say, speaking to concerns or issues with universal pre-K and how funding and the master plan sort of flows into that. So I would like to invite Virginia to speak on that a little bit.
Perfect. Thanks so much, Alana. And thanks everyone for your questions. So specifically related to the master plan, we've spoken about it a little bit on some of these past webinars, but the master plan is, addressing this. So one of the first things it talks about is providing California's 3- and 4-year-old children with access to a high quality preschool experience. And so it recommends that California work to build a unified system of state-funded preschool for these children, setting the goal that all 4-year-old children have access to a year of free, universally available, and fully inclusive preschool, and that all 3-year-old children in income-eligible households have an access to it, to preschool sort of as a 3-year-old as well, and that also be publicly funded, full inclusion with incentives for families, for all families to enroll. So the state's master plan outlines several specific action steps the state should take around achieving these goals. First of all, there's a piece around aligning and strengthening current programs, program design and quality standards to create an enhanced program. So, for example, we know that the transitional kindergarten and the California State Preschool Program have different standards, and many of the transitional kindergarten teachers, you know, they don't have the same type of, you know, training or background sometimes as a California State Preschool Program teacher, and they're different ratios and class sizes and other professional learning requirements, and so working on those. Then it talks about phasing in universal preschool for all 4-year-old children, starting with targeted highest need areas first. So going sort of step by step, and then phasing in access to preschool for all income eligible 3-year-olds, again, starting with highest in need areas. So we know that a lot of people have seen sort of the governor's budget proposal as, what does this mean for the future of CFDP? What does this mean for the future of 4-year-olds in my program? I think we're still waiting for some more details on the governor's budget proposals. So I think at this point, we would direct you to the master plan, and just to say from our perspective, as it relates to the budget, we really do appreciate the support for transitional kindergarten, but we're also really looking forward to enacting the master plan recommendations, which will support a mixed delivery system with community-based organizations meeting similar standards. And we also know that many of our state preschool programs are really struggling in terms of the rates that they have. And so we're waiting for some more details on the transitional kindergarten proposals, with also this recognition that this is not the only piece of the implementation of the broader vision for preschool in California. And you know, we're going to continue to be part of those conversations. And like I said, we're looking forward to moving forward on the master plan recommendations that support the mixed delivery system. So I'm going to stop there. I think we'll have more to say on this topic as the spring progresses, but I did want to address, at least at a high level, the questions we're getting.
Excellent. Well, I know, Virginia, that I'm going to be asking and calling on you again. So there was a question that we answered, and I just want to make sure that it's reiterated out loud of, what is the likelihood that the hold harmless clause will continue into the next fiscal year? You know, i.e. that attendance and enrollment will not be a factor into reimbursement.
Thanks so much, Alana, and thanks to Lori for asking that question. So as I responded to Lori in the Q&A function, I think that's a little hard to say at this point. So you saw me walk you through what's in the governor's proposed budget. I wanted to really emphasize this is a proposal. This is not the final budget for this upcoming year. So it's not included in the governor's proposed budget, but I know it's something that many will advocate for with the legislature. We heard from a couple people on this Q&A saying that they were planning on advocating for it, and they were hoping that CDE was too. It's definitely on our list of things that we're watching, and you know, aware of where folks are coming from on this. So I'd also flag that there is some additional federal funding coming down at some point in the spring. It hasn't actually gotten to California yet. So there will likely be revisions to the current proposal once that federal funding arrives in the state, because that funding will need to be, the legislature and the governor will need to determine how to allocate what the money is for, and then it will need to be implemented by us and by DSS. So just wanting to flag that this is governor's budget, even though it's not in the governor's budget, that doesn't mean that it's not happening, but it would need to be added in, there would need to be a change in statute for that. So if this is something that you care about, I would encourage all of you to reach out to your elected members of the state legislature.
And I would
And
just,
I think I want to say something too.
yeah, I would just second what Virginia's saying about steps to move forward on a continued hold harmless, because we know that, you know, it's January, and yes, there's a vaccine, you know, on the way. It's going to take a while though, and it's going to take a while for us to get back to get back to normal. So it's on our minds, and we know that it's something that will be needed as we look forward to 21-22. But like Virginia said, it's something that would have to be added into statute, and it's not presently something we see in the governor's budget. But we know it's needed.
Okay, thank you. A lot of the outstanding Q&As are just responses to what is parental choice? How do we talk to our legislature? So instead of having to repeat that, because we have just a few more minutes left, there have also been some questions regarding the management bulletin that was released today. So I'm going to ask Deborah to come back in, and a few of them will just be repeats, but everybody learns differently. Some people are better at typing and, you know, reading, and others need to hear it orally. So let's pull off a good one. I mean, they're all great questions. We do appreciate your engagement here. So one of them was about from the understanding we are still to do the ECHRS and that there's no waivers for the ECHRS. How do we do that if we're still distance learning?
Well, in regards to distance learning, you obviously cannot assess a child's environment if they are getting those distance learning services at home only. You know, we do know that a lot of programs are doing hybrid models. So they might have some children at home doing distance learning and some children in the environment. And so for those programs that are offering in-person services, you should be assessing your environment using the appropriate ERS tool, but you cannot assess a child's home environment. It's not equivalent to their school environment. So that is understandable that you won't be able to complete an ECHRS or a FICRS or whatever the case might be if distance learning services are the only services being provided.
Excellent. Thank you, Deborah. There's also a question about when do you anticipate having a webinar specific to the MB? And they're also asking that it's hopefully not too close to a self-review due date that's in the spring.
I do not have the answer to when that when that webinar is planning to be presented. I do know that the team has already been working on the presentation. So I think sometime in February is an anticipated date. So.
Thank you. This is Erica Otieno. I can add to that. We are working on we're almost done with the PowerPoint. We're thinking about mid-February for that presentation. So stay tuned. It's titled Working with Children in Times of Pandemic. Then we conclude that presentation with how do you pull it all together. So, coming soon.
Excellent. And that sounds like that's a very indicative title. There's still a few more questions about the ECHRS coming in, but I'll ask that Deborah can respond to those in the chat. Let's see what else we've got. in our last few minutes here.
There were a couple similar questions in regards to the parent survey. I know that the current parent survey, if you are only providing distance learning services, some of the elements of that parent survey might not be applicable, but many of them are. So you can still present that parent survey to your families, and there's nothing to say that you can't add more questions that are relevant so that you can gather as much feedback as possible, so that you can implement your services and meet the needs of your families to the best of your ability.
Thank you so much, Deborah. That is correct. Thank you. It's about flexibility.
Okay. So there is a question regarding TK requirements. I'll ask that either Virginia or Danielle speak. So the question itself is, the new plan TK requirement eliminate choices for those most vulnerable and in need of flexibility, knowing both TK and K is not required. Additionally, it places undue burden on school districts operating CC. I think that meant to be operating CSUP programs.
So I think for that one, it sounds like that was somebody responding to sort of why are we expanding TK instead of CSPP and some of those pieces. I think just wanting to flag for you that as you have feedback on the budget proposals, to make sure that there will be legislative hearings on these proposals, so you can go and give public comment. These are still proposals, and so I think the role of the field to really share their perspective and inform the development is really critical. So thank you. I also see there's a question about sort of, okay, so there's a master plan. How does the master plan go from plan to implementation? And so how and who decides what proposals from the plan are codified into law and in what order? And I wanted to address that one as well. So basically, it's the governor working with the legislature through a publicly accessible process that has an input process through hearings, where they can do public comment. You can always send letters to the members of the legislature, to the governor about that. So it's not law yet. It has to go through a legislative process to become law. And they're not going to be able to do all of the master plan at once because of state fiscal constraints, and also just the ability of the system to only be able to have so many things going on at once. So just know that this is a plan and a roadmap that the governor has set out for where he wants the system to go, but know that he has to work with the legislature, and then the legislature has processes for how the public can provide input as it moves from being a proposal or a plan into actually being state law.
Okay. Well, thank you very much. There's a few questions that are outlining. I will encourage all of those who are here to type in as many Q&A responses as possible while I ask for the next slide to go through so that I can read out loud. So if you've got some fingers, let's do some typing and get these answered. While that's happening, some resources that we have for you, our webinar slides and all of the MBs and frequently asked questions can be found on the ELCD's COVID-19 guidance webpage at https://www.cde.ca.gov/SP/re/ELCD COVID-19.asp. You may also submit emergency additional questions to our ELCD emergency email inbox at elcdemergency@cde.ca.gov. Also, please to contact your PQI office regional consultant A list of those consultants can be found at the ELCD Consultant Regional Assignments webpage at https://www.cde.ca.gov/sp/assignments.asp. And as you most know, consultants are most easily reached by email. If you must call, the telephone number for our consultants is at 916-322-6233. To contact your child and adult care food program county analyst, a list can be found at https://www.cde.ca.gov/ls/NU/CC/CACFP contact@ASP. To access the main page of the Child and Adult Care Food Program, where you can find links to trainings and so much more, please visit https://www.cde.ca.gov/ls/NU/CC. For more information about the Master Plan for Early Learning and Care, please visit https://www.chhs.ca.gov/home/master-plan-4-early-learning-care/. So I would like to invite Erica and Steve for closing while we continue to answer any unopened questions.
So on behalf of all ELCD staff, both in front and behind the scenes, I just want to say thank you to all of you for all the good work that you do for children and families. Let's continue to do what we do. The future looks bright for our children if we continue to provide them with good programs. So thank you so much for logging in today. We look forward to seeing you next time, which will be February 5th, I think. Thank you, Steve, for nodding. Again, remember the PQI consultants, administrators are always available to you. If you email the consultants and you don't get a response, make sure you can email the administrators, because we just started our remote monitoring, which has been a little challenging, but we're there. So so a little computer glitches, but we're almost there. So thank you, everyone. Keep up the good work, and we'll continue what we do with families. Thanks.
Thank you, Erica. And thank you, everyone, for joining us at this later than normal time. We hope you found today's webinar helpful. On behalf of the entire CDE team, we thank you for joining us, and we hope you'll join us for our next webinar in about 2 weeks, a couple Fridays at 10 a.m., February 5th. So with that, please take care of yourselves, be safe, be kind to each other. We can't do any of this without you. We're looking forward to getting back to normalcy, some normalcy. The vaccine presents us with hope for the future, and we'll get there together. Thank you. Hope this is your last work thing of the night. But if not, many of us will be working after this, so we'll join you in solidarity. Have a great evening, everyone.